Welcome back, everyone. Even though we all hear about skin cancer, there's still no shortage of people laying out with baby oil or heading to the tanning booth.
This year, more than 81,000 Americans will be diagnosed with skin cancer, and the vast majority as a result of sun overexposure.
Dr. Johnny Koval from Tampa Bay Radiation Oncology is here with tips on how to detect and protect against skin cancer this Skin Cancer Awareness Month and beyond. Good to have you here.
Thanks. Nice to be here.
I think a lot of people assume that if you're fair and Caucasian, you are definitely at risk, but they don't take into account that other ethnicities are all at risk.
Everyone's at risk if they get enough UV exposure. That's correct. And the fair-skinned people are more at risk, probably a little bit, but it's easier to detect skin cancers on fair-skinned people than it is on darker-skinned people, and so sometimes they get, like particularly melanoma, can get more advanced in dark-skinned people than light-skinned people because it's harder to detect.
So everybody should be using the sunscreen.
Yes, everyone should.
Every day, though, not just when they're out playing in the sun or at the beach.
Every day, even inside, all day long, but especially if you're going to be outside.
Okay. Wow, I just have to say that Florida has the second greatest amount of new melanoma cases each year.
Yeah, the Cancer Society statistics show that California is the highest and Florida is the second highest in the United States.
So what can we do? Because we're all told we have to get vitamin D, and the best way to do that is to go out and enjoy the sun. But
you can get that in vitamins, you can in supplements and that. You don't have to go out in the sun to get that, but it does help to be out in the sun for that, but you can actually get it with vitamins.
But you can get that just by being outside for 15 minutes, and you get your daily dose. So you don't have to bake all day.
No, it's a short exposure.
So avoid the sun at its peak hours if you can, between 10 a.m. and 4 p.m.
That's correct.
And if you do have to be out, then cover yourself.
Then cover your up, hat, glasses, sunscreen, just cover-ups.
How do you feel about clothes with sunscreen in them? Do they work?
I think they do, yeah. The fibers are such that it can protect from UV.
But no excuse not to wear sunscreen in addition to that, right?
That's correct.
Okay. We have some graphics that we want to take a look at because a lot of people have moles on their body. A lot of them are in places that they don't check or they don't even see. And so you have to really ask anybody in your family to take a look for you as well, right? This is one mole here that we're looking at, and explain for us why this is a risk.
Well, it's a funny shaped mole. If you go by the ABCDs of melanomas, it's asymmetrical. It's got a funny shaggy border. The colors are different, and I don't know what size particularly that is, but if they're generally over about 6 millimeters or so, the size of a pencil eraser, it's something that needs to be looked into.
Definitely. Okay.
And multicolored too, you mentioned. Right. That's really important. If any coloring of any mole is different, then you should really pay attention to it.
Yeah, it needs to be checked out.
Okay.
Okay, B stands for border. Oh, look at that. Okay.
Yeah, that's a very irregular border and something that needs to be taken off probably.
Is it easy for you to take something like that off?
Sometimes with melanoma, it's a pretty big surgery.
Oh, yes.
I do radiation oncology, so I would treat skin cancers with radiation, but sometimes the surgeries are simple, sometimes they're involved.
We have another mole to take a look at now, and we're looking at the color.
Wow. Yeah, that's just really multicolored, you know, black and orange and yellow and green, and it definitely a melanoma, at least clinically.
By looking at that,
I would say that would be my diagnosis, yeah, by looking at it.
And when you look at these and you look at the colors of them and the shapes of them and, you know, how big the border is, can you tell how, you know, how big the problem could be or is possibly?
Well, you get an idea, but you really have to take it off and measure it to see what the depth is and
how far it goes.
The thickness is, yeah.
We've got one more mole to take a look at. If you notice anything like these on your body, please get to the doctor. Tell us about this one.
It's another one with irregular borders. It's different colors, and it's asymmetrical. So it's the ABCDs.
Right. Is it like, you know, if your mole is larger than that, like a pencil eraser, that's something to really, you know, be cautious
particularly if it's enlarging or if it's changing in size or a changing sort of thing. I mean, a lot of us have moles that are the size of a pencil eraser that you just don't have to worry about. But as long as they're symmetrical and they don't have a funny color to them and they're not getting bigger, they're probably nothing to worry about. But if any of those things change, they should be checked into.
Okay, Dr. Johnny Koval from Tampa Bay Radiation Oncology. Thank you very, very much.
Thanks a lot.
We'll be right back.